After each patient interaction in the treatment room, we hustle and quickly gather our instruments for reprocessing and turn over our room for the next patient interaction. We do it so many times in a day that it's important to stop and consider whether it's being done properly. Here are 3 tips that can help make your operatory turnover safer and faster. First, you can have an EPA-registered hospital-grade tuberculocidal disinfectant with a contact time that ranges from 1 to 3 minutes. A large portion of your time during operatory turnover is spent on cleaning and then disinfecting. This 2-step process allows the clinician to first remove large number of microorganisms from that clinical contact surface and then disinfect these surfaces. Disinfection is generally a less lethal process of microbial inactivation compared to sterilization that eliminates virtually all recognized pathogenic microorganisms, but not necessarily all microbial forms. I think we can all agree this is a pretty critical step and we cannot cut any corners. But we can find disinfectants that will allow us to perform this important task faster. Second, barriers protect clinical contact surfaces, especially those that are difficult, cumbersome, and time-consuming to clean, such as switches on dental chairs and computer equipment. These areas require time to ensure all the nooks and crannies are correctly cleaned and then disinfected. So why not cover them with a barrier wrap impervious to fluid penetration? Once you're done with the patient, you can remove the barrier without contaminating the surface and save time on the cleaning and disinfecting stage of the operatory turnover. So this helps to reduce chemicals used in your operatory and the amount of time spent on cleaning and disinfecting every clinical surface. Keep in mind, many electronics like keyboards and mice cannot tolerate the cleaning and disinfecting process and must be covered with barrier wraps. Third, to ensure you are safe during operatory turnover, properly sized utility gloves to prevent percutaneous injuries are necessary. I know you hate them because they're big and bulky and you end up dropping everything and it just kind of slows you down. And I do find this to be true when the utility gloves are not correctly sized. So often I'll go into an office and find one size that fits everyone. But in reality, each clinician should have appropriately sized utility gloves for operatory turnover and instrument reprocessing. All dental health care providers need to wear puncture and chemical resistant utility gloves when cleaning instruments and performing housekeeping tasks involving any contact with blood or potentially infectious material. Emphasis on cleaning and disinfection is placed on surfaces that are most likely to be contaminated with pathogens, including clinical contact surfaces in patient care areas. When these surfaces are touched, microorganisms can be transferred to other surfaces, instruments, or to the nose and mouth, eyes of a dental health care provider or even patients. Although hand hygiene is key to minimizing the spread of microorganisms, clinical contact surfaces should be barrier protected or cleaned and disinfected between patients while wearing proper personal protective equipment, which includes utility gloves. Be sure to find products that will help you perform this important task and allow you to do it faster and safer.